Hey everyone. So what is edema and why do hand therapists care about it? Edema is essentially the accumulation of fluid in the tissues of the body. So hand, arms, feet, toes. Um, and it's the body's response to injury. So it's a normal reaction. However, the body tends to produce too much of this fluid. Um, the fluid contains white blood cells and other sort of compounds and cells to help the body heal. But unfortunately, the body produces too much. This results in a very stiff finger or hand, and the reason that therapists don't like stiff fingers is stiff fingers often lead to joint contractures. And joint contracture is essentially the scarring down of a joint. If a joint scars down, it can lead to shortening of the tendons and overall just significantly reduce the functional ability of your hand. So we do not want that. We want to manage that swelling and bring it down so we can increase that range of motion in your hand. And therapists have quite a few strategies to limit edema. Number one is elevation. So elevation is pretty simple. All you need to do as a patient is keep your hand above your heart. That's the general rule of thumb. The reason being is swelling tends to follow or go wherever gravity takes it. So if you elevate your hand, gravity is going to bring it down towards your armpit, and that's where your lymph nodes are. And there, the body can pump out that fluid to the rest of your body and get it out of your arm and your fingers. So some of the strategies that patients can use is they can just prop it over their head, just hang out. Also, when they're sleeping or watching TV, just stack some pillows, have your hand just hanging out to the side of you or in front of you or like this. But it's really important to just keep it elevated as much as possible. That way, additional swelling doesn't pull in your fingers. Because with more swelling, that's going to lead to more pain, more discomfort, and more stiffness in your fingers. And no one wants that. Another strategy, which you probably already saw on my finger, is compression. So you can use Coban for fingers or compression sleeves. Same thing for the arms. Forearm and the arm. Compression is going to help move that fluid back up the arm towards the heart and throughout the rest of the body. So compression is great, and your therapist has all sorts of really great tools to help you with that. Another strategy is just using your hand. So moving your hand up and down is really good at moving fluid up your arm and again towards that heart. So some of the exercises that I show my patients, it's a lot easier without Coban on your hand, so I'm going to go ahead and take that off. But essentially, the first activity, you're just going to pump your hand. And you're going to do that 10 times, and you're pumping with force so you can really get that fluid back up to the heart. So go ahead and pump up and down 10 times. And after you do that, the next exercise is spreading your fingers. So going like a starfish. And again, you'll do that 10 times. And both these exercises, you'll do 2 to 3 times a day. And when you do them, make sure that you're doing it in an elevated position. That way you can help that fluid drain out a little bit more. One more strategy is retrograde massage. Essentially what that is just massaging where the edema is, and you're massaging towards your body, because if you can massage from the start to the bottom, you're going to be bringing the swelling down to your heart, and that way it'll get pumped out through your body again. So start from the end. I'm just massaging that index finger, trying to get that fluid out. My index finger isn't injured, but this is a good example of just kind of what it is. So pretty easy massage, and you're really just trying to get all sides of the finger so you can really bring down that fluid. All right, I hope that was helpful. Just a few different strategies to manage swelling, and also just the reasoning behind why hand therapists and patients suffering from hand injuries do not like swelling. All right, if you have any comments, feel free to leave them below, and thanks everyone.